Thanks to tremendous technological advancements and new innovative surgical procedures developed in the last 4 decades, the dream of clear vision without corrective lenses can now become a reality for almost everyone who wants to live a lens-free lifestyle. Every year in the United States, over 2 million patients are diagnosed with cataracts. A cataract is a clouding of the eye's natural lens inside the eye, which interferes with light reaching the retina. Left untreated, it can eventually cause blindness. The good news is, cataract surgery is the most common and one of the most successful surgical procedures performed today. Vision for most people remains relatively stable until they get into their 40s, whether they're nearsighted or farsighted or normal-sighted. Around that time, the eye's natural lens begins to gradually thicken and harden, making it difficult for the muscles inside the eye to focus the lens. This is known as loss of accommodation, or presbyopia, and its earliest symptom is difficulty seeing things up close without the use of reading glasses, or cheaters, as some people call them. Many people who are farsighted before the onset of presbyopia can see well at all distances. But when the natural lens loses its flexibility, it often becomes necessary for them to wear bifocals or even trifocals to see well at all distances. If you happen to be in this 40 and over age range and you're experiencing problems such as these, you may be eligible for a procedure that can restore your vision and eliminate your dependence on glasses for most activities. Cataract surgery is the procedure name we use if you have a visually significant cataract and you're experiencing blurry or cloudy vision. If you do not have a cataract, or if your cataracts are in the early stages of formation, the procedure is called refractive lens exchange. To restore vision after the natural lens is removed, your doctor will implant an intraocular lens, or IOL, into the place that held your natural lens. The traditional method of removing a cataract along with implantation of an intraocular lens is one of the safest and most successful procedures performed in medicine today. Now, a technological breakthrough with bladeless laser cataract surgery is available that has significantly improved the precision of several of the most critical steps in cataract surgery. With laser cataract surgery, your surgeon will customize your procedure to your unique visual needs, resulting in better visual outcomes and potentially making cataract surgery even safer. With traditional cataract surgery, incisions are created with a blade, while with laser cataract surgery, they are performed with the precision of a femtosecond laser. If the patient has astigmatism, traditional cataract surgery requires a blade to create arc-line incisions in the outer margins of the cornea to correct the astigmatism. While with bladeless laser cataract surgery, these incisions are performed with the laser. To remove the cataract, an opening must be made in the thin capsular membrane that surrounds the lens. This step is called the capsulorhexis. Studies have shown that less than 10% of manual capsulorhexi, which are made with a bent or shaped needle, have been able to achieve the same accuracy that is produced when they are made with the laser. The consistently precise laser-controlled capsulorhexis contributes to better lens positioning and therefore more predictable visual results, which is especially important with premium IOLs. Once the outer capsular tissue is opened, the lens must be split into manageable size pieces for removal. Traditional phacoemulsification uses ultrasonic energy to divide the natural lens into quadrants. This step is now performed in an instant and with much less energy with the femtosecond laser. With both traditional and laser cataract surgery, the fragmented pieces of the cataract are vacuumed from the eye with phacoemulsification. However, with laser cataract surgery, the femtosecond laser actually softens the lens, so less ultrasonic energy is required to remove the cataract. This means there is less stress to the delicate fibers and membrane that hold the intraocular lens in place. Once the cataract is removed, the intraocular lens of your choice is inserted through the self-sealing incision and locked into position. Typically, no sutures are required. The procedure is performed as outpatient surgery, one eye at a time.
It was a piece of cake. I mean, any kind of surgery, you have to have a little bit of apprehension, or I think you're dead. But I was amazed at, about the time I thought they were just getting started. He said, well, that's it. You're all fixed up. So it was not relatively painless, it was painless.
Today, people who have their natural lens removed can elect to have the standard IOL that typically provides excellent distant vision, or one of the more technologically advanced IOLs that can provide a full range of vision, meaning you can read, see clearly in the distance, and everything in between, with little or no dependence on bifocals, trifocals, or contact lenses for most of your activities. Which of these advanced IOLs is best for you depends on the unique characteristics of your eye, as well as your lifestyle needs. You and your doctor will decide together which lens is more advantageous for you.
Now it's just like when I was a teenager. And I love the fact that I can be around people a lot younger than I am, and they're just grabbing for their glasses, and oh, I can't see without my glasses, and I just say, what do you want me to read? And I read it for them. And they say, oh, I forgot about your bionic eyes, and things like that, So it just makes you feel good.